This is a presentation on Diarrheagenic Escherichia coli, also known as E. coli. Some types of E. coli are a normal part of the gut microbiome. Some cause urinary tract infections, respiratory infections, and meningitis. Others can cause diarrhea and other gastrointestinal issues, which will be the focus of this presentation. There are 5 different kinds of diarrheagenic E. coli, referred to as DECs. In pregnancy, DECs may lead to dehydration and electrolyte imbalances. These can have a negative impact on the pregnant person and the baby. It's important to note that proper management is essential to reduce the chance of severe complications. The first DEC is called enteropathogenic E. coli, also known as EPEC. This type of E. coli adheres to the intestinal wall and disrupts normal cell function. Severe watery diarrhea is usually present without blood. Most often, a fever is present. This can come with or without nausea and vomiting and lasts anywhere from 3 to 7 days. The next type of DEC is called enteroaggregative E. coli, also known as EAEC. This is one of the causes of traveler's diarrhea, and it's very similar to the previous type that we discussed because this also adheres to the intestines, although this one adheres in a slightly different pattern. It causes a persistent infection and inflammation by the toxins it releases, less common for a fever, more common for nausea and vomiting, and often there's abdominal cramping. This usually lasts 1 to 3 days in healthy individuals, but someone with a poor immune status might last up to 2 weeks, and there's a greater need for antibiotic treatment when it lasts this long. The next DEC is enterotoxigenic E. coli, also known as ETEC. Like the name says, it also produces toxins, and this is the main cause for traveler's diarrhea. ETEC toxins increase ion secretions in the intestines, and this happens to lead to additional fluid loss. There's watery diarrhea, abdominal cramping, and nausea are usually present. You're less likely to vomit or have a fever. What makes this different is there's actually an increase in gas, and bloating is very common. Lasts from 1 to 5 days in most healthy individuals, but can last up to 2 weeks in people who have a weaker immune system. The fourth out of the 5 DECs is called enteroinvasive E. coli. As the name states, this type invades the cells of the intestines, and it does not produce toxins. It causes disease by triggering an immune response. This includes inflammation and causing necrosis of the infected tissues. This invasion causes more serious symptoms such as blood in the diarrhea. Fever is almost always present with EIEC. Usually there is not nausea and vomiting. Abdominal cramping may be more sharp and is usually more severe than other types of DECs, typically lasting 1 to 5 days or up to a week in severe cases. Enterohemorrhagic E. coli is the most serious of all DECs. These can produce Shinga toxins that actually cause cell death and can damage the blood vessels. This leads to severe watery diarrhea that's often bloody and can lead to complications such as hemolytic uremic syndrome. In EHEC, in addition to the bloody diarrhea, other symptoms are abdominal cramping and a mild fever, and feeling tired and weak. Usually, there is no nausea and vomiting, but it can occur. Symptoms typically begin to appear 3 to 4 days after exposure, and it can last as long as 1 to 10 days. EHEC can cause a hemolytic uremic syndrome, which is a life-threatening condition that leads to kidney failure, anemia, and low platelet count. Signs of pus or decreased urine output, paleness, swelling, especially in the hands, face, and feet, or bruising easily. This is a life-threatening emergency and needs urgent care. So let's talk about the risks in pregnancy when someone does develop a DEC. In addition to HUS, diarrhea can lead to dehydration and electrolyte loss, and it can reduce the amount of amniotic fluid, and this can lead to preterm labor, and this can also even cause fetal distress. So some strands of E. coli can actually increase the risk to a pregnancy with a urinary tract infection, and it can complicate the pregnancy, but most DECs don't actually cause a UTI, but it can happen when it travels from the anus to the urethra with poor bathroom hygiene. So let's talk about transmission. These DECs are typically transmitted through fecal-oral routes, meaning through feces. This can be done through contaminated foods, person to person transmission, contaminated water, surface or objects, as well as even from animal to person transmission. The best way to avoid a DEC infection is going to be through prevention. Some of the ways that this can be done is to have proper hygiene and food safety, such as when you're handling food, use proper hygiene, avoid consuming undercooked or raw meat or unpasteurized foods. Because of the fecal oral transmission route with DECs, it's essential to practice hand hygiene after using the restroom or even changing a diaper. When traveling, it's recommended to avoid traveling to any places that have poor sanitation, and it's also good to avoid consuming any possibly contaminated water. So, if somebody does get a DEC, it's good to know that they usually clear on their own, and the treatment should really focus on relieving the person's symptoms and making sure they're staying hydrated. Sometimes that may look like IV hydration, and then monitor for signs of HUS or sepsis. However, if there's blood in the stool, testing and antibiotics may be indicated. In midwifery care, if a client's condition continues past the normal length of the infection, or if symptoms seem more severe, then testing and referral for further care is indicated. Diagnosis of an E. coli infection is typically going to be made through a stool culture or PCR testing. E. coli infections are not common during pregnancy. Antibiotics are usually not used due to the increase in antibiotic resistance, and antibiotics are usually going to be saved for more serious DEC infections. And remember, prevention is the priority with good hygiene and good food practices.